Welcome to the Baptist Health Doc to Doc podcast, a conversation for physicians by physicians, providing insight on the latest in medical practice, research, technology, and innovation in healthcare on the Doc to Doc podcast.
Many technological breakthroughs in the past decade have advanced how surgical procedures and diagnostic tools are applied. But the one tech breakthrough that has game-changing promise more than ever is AI. AI is rapidly becoming one of the most influential weapons in the battle for saving and enhancing lives. AI has dynamic potential in every aspect of modern-day medicine. But today, we will focus our conversation on this potential within the field of cardiology and cardiothoracic surgery.
Hello, I'm Dr. Tom Nguyen, the Director of Minimally Invasive Valve Surgery and Chief Medical Executive of Baptist Health, Miami Cardiac and Vascular Institute, and the Katzen Endowed Chair.
And I'm Dr. Nish Patel. I'm one of the interventional cardiologists at Baptist Health, and I specialize in catheter-based treatment of valvular heart disease, and I'm Director of Structural Heart Program at Baptist.
Thank you, Dr. Patel. I'm going to call you Nish because I work with you every day, if that's okay.
Yeah.
You know, the powerful thing about AI is the ability to comb through mass amounts of data and come up with information for us. And one of the things that we do every day that has mass amounts of data is the EMR system. Can you describe, what AI or what kind of solutions that you've heard of using AI that can comb through EMR and maybe do something that might help us be better doctors?
Yeah, thanks, Tom, for the question. So, as you pointed out, we deal with so much of data, and the disease that we are treating is so complex. And there's multiple studies which have been done, for one patient, and how to go about all those studies and making sure that we are treating the patient as early as possible. So, I've heard one solution, in fact, two of the companies which have worked on it were, in our valvular heart disease space, they would look at your EMR and the entire journey of that patient since the patient came into the health system and look at their echocardiogram, look at their EMR.
And for the audience out there, what's EMR?
So EMR is electronic medical records. Going through the whole electronic medical records, going through the whole imaging which has been done for the patients, such as EKGs, echocardiogram, or cardiac catheterization, they would able to tell that, let's say, if the patient has, aortic stenosis in your system, there are so many patients that we have in our health system. And there may be some patients are out there who have some disease such as aortic stenosis, but they are not being treated for that. So the solution would be able to look at the EMR, look at those studies, and would be able to tell us that in your EMR, these are the number of patients who have severe aortic stenosis, and if you treat them earlier, you would be able to impact their mortality. And it would also be able to tell you that, let's say, if the patient had an aortic stenosis few years ago with the echocardiogram showing moderate aortic stenosis, and that patient had multiple echocardiograms, it would be able to tell you that what's the progression of the aortic stenosis. And let's say if you do the echocardiogram right now, what are the chances that this patient has severe aortic stenosis? And by doing that, you would be able to identify the patient earlier in their disease journey, rather than, catching them later in the disease process where, when we treat those patients, the outcomes are also not great. Versus when you treat those patients earlier in their disease journey, the outcomes are much better and you're impacting their life expectancy earlier.
As physicians, we can only treat what we know. And there are a lot of patients who come in and they might not know they have aortic stenosis. They might come in with a stub toe and they get an ultrasound done. They have severe aortic stenosis. And we know the natural history of aortic stenosis. Patients will die within 2 years. 50% of patients die within 2 years, but they might not know that. But being able to pick that up sooner could save a lot of lives. But why not just hire someone? Why not just hire someone and go and comb the medical records? How many people would that take? Is that feasible?
Yeah, not feasible at all. Because, we can have, people looking through the echocardiogram, but still it won't be able to look at the whole EMR, won't be able to tell you that what's the rate of the progression of the disease. And plus, we still can have error. There's a human error that always going to be there. So that's there. And plus, it's a very labor-intensive job for somebody to go through the whole chart. So I think right now, only few institutions are doing it, and we are a part of it. But in 10 years, this would be a norm. That we won't be discussing about this. This is how the practice is going to be done.
Yeah, I agree. I think AI is inevitable. It's going to change our future. It's just how we embrace it and how we regulate it is key. So we talked about combing medical records and coming up with a list of diseases, but maybe tell me more about how AI can assist us in making diagnoses, or particularly if it's a complex diagnosis.
Yeah, another great question. I just give an example. I saw a presentation. I attended a course also. Paul Friedman is he's a chief of cardiology at Mayo Clinic, and I saw his presentation. And Mayo Clinic has an EKG algorithm that they have worked for the past 4 or 5 years, or even longer. And EKG is such a simple tool. Most of the patients who come into the health system, most of the time they have an EKG done. And just by looking at the EKG, that algorithm can tell you that what's the patient's age. And not the chronological age. What's the physiologic age of the patient? What's the gender of the patient? It would be able to tell you that the patient has a valvular heart disease or not. Do they have decreased ejection fraction, heart failure or not? If they have occult atrial fibrillation or not. And hypertensions, hypertrophic cardiomyopathy. So those kind of things, just an EKG is able to tell you, where no further imaging has been done. And about that physiologic age part, there was an example he gave where a person was a 50-year-old. AI predicted that the age of this patient is 73. And then a few months later, the same EKG was done, and the AI predicted the age is 25. So what happened? What could have happened? That just in 3 months, the AI predicted the age is 25. That patient got a heart transplant. So he had a heart failure.
He had a new heart?
Yeah, he got a new heart.
He had a 25-year-old heart.
And the AI predicted the age is 25. And similarly, there was another patient who was a 35-year-old and was obese, and that AI predicted the age is 42. Yeah. The patient lost about 20 pounds, and afterward, this EKG was repeated, and now the AI predicted the age is 36, which was the patient's chronological age. So how powerful that would be for the patient also, that, this is what's your physiologic age, and you need to do something about it. We need to go as upstream as possible to diagnose the disease in the early stage, because having a primary care physician notice something, let's say a patient's symptoms, and then referring to a cardiologist, and cardiologist doing some testing, and then finding out, okay, yes, there is an issue, and then referring to another specialized physician to do some sort of procedure or surgery about it. Rather than that, imagine if a digital stethoscope, which primary care physician just use it, and it would be able to tell you that, okay, patient has valvular heart disease, and patient just directly go to the person who's going to treat the patient.
I'll give another example. I guess we talked about heart disease, but the number 2 killer in the United States is actually lung disease or cancer. And there are AI algorithms out there now that can look at an X-ray and then find that little nodule and be able to tell whether that nodule looks suspicious or not. And something that most or many radiologists might not focus on because they have so many other things to focus on. And that's why I think the powerful thing about AI is in that, we as humans learn by picking up patterns, right? We pick up patterns, but you can only kind of see things when you pick it up. With AI, it can use the mass data and pick up on patterns that we're not even seeing or recognizing. So the EKG has so much data on there, but in medical school, we learn basic stuff about it, the QRS interview, the PQRS, et cetera. But there's often maybe other variations. We don't learn to look at maybe the depth of the QRS. We don't learn to look at the spacing between the intervals as much. And the beautiful thing about the big data with AI, it's able to do that. I want to offer a really neat experiment that's kind of similar to what you said with the EKG. They use AI to show ophthalmologists retina scans and then have the ophthalmologist try to predict whether it was a man or a woman. And of course, the ophthalmologist got it right half the time. But incorporating the AI algorithm, it was pretty simple. They would show the retina scan of a man, and they would tell the AI machine learning, hey, this is a man, show a retina scan of a woman, here's a woman, and do that thousands and thousands and thousands of times. And the AI was able to pick up things that most humans weren't able to recognize. So then they did it again and then showed a brand new picture of a retina scan of a man. And then the AI was able to get it right 97% of the time. I mean, it's amazing, right? It's amazing because we can only pick up what we know and see, but there's subtle things that the machine learning can pick up that we're not seeing. That's the power of it.
Absolutely. I think I was just thinking that by doing that examination, the AI probably can predict if the patient is going to have hypertension or diabetes because retina get affected with those diseases too. And similarly, there was Stanford had this algorithm that they have worked on, which is essentially, so many patients get CAT scan, right? Patient come in and they have some sort of issues and the CT chest is done multiple times. And one of the thing that we use for risk stratification of asymptomatic patients is calcium score. Calcium score is essentially a scan of the heart, and it tells you that how much calcium that you have in your heart artery. And based on the score of that, we can predict that what is the chance of patient getting a heart attack in next 5 to 10 years. Higher the score, higher the chances of patient getting a heart attack. So how can, if we can implement the same thing on any scan which is done, not dedicated calcium score, because any scan would also be able to identify the calcium in the heart artery. So they actually did that. And then later on, those patients who had calcium score elevation, they did the study of notifying the patient you have this disease and you should be on statin because statin would be able to prevent the heart attack and the control arm. So they saw a difference that 50% of the patient that they were notified started taking statin and they were not on statin versus in control group, only 9% ended up being on statin. So just by doing that, it's amazing that those 50% of the patient were able to be on statin and have reduction in the heart attack for the next 5-10 years.
We're talking with so much excitement, but the reality is a lot of this is relatively new. The AI has been around for a while, but the explosive growth in AI has really happened within the past couple of years. Yeah. And I really think we're at the tip of the iceberg.
Yeah. Yeah, you're right. You're right. What do you think about AI in surgery and robotic surgery? Do they have a role in surgery or robotic surgery at this point?
I think there's a role. As surgeons, what we do is very technical. So we have to use our hands. In things that we have to use our hands for, I don't think AI can help just yet. But I think AI can potentially help us become a better surgeon before we get to the operating room. The better planning beforehand, figure out what exactly is going on. So, for example, you have a complex valvular issue or a complex anatomical issue with the heart. You can use a lot of AI to kind of predict, what the problem is, what's going to happen after you fix it. So when you're in there, you actually can be a better surgeon. But I think it's hard right now if I'm holding an instrument for AI to hold my hand per se. But on the other hand, there's a lot of AI in robotic surgery. So another aspect that surgeons use is using robots to actually operate on patients. And that's a different animal because the surgeon's actually not holding the instrument. The surgeon's at a console moving a joystick around, and that joystick is controlling an instrument inside the patient's body. And with that, there's a lot of opportunities because then you can use AI to predict movements. You can make the movements more smooth. You can remove the tremor out of a surgeon's hands. Although I don't have a tremor, for the record, but for other surgeons, I might have a tremor. But you can take the tremor out, which is fascinating. So I think there's potential, and there is a trend towards maybe more robotic surgery because of all these potentials.
So then it would be able to prolong the career of the surgeon too.
That's right. Absolutely. Yeah, and for sure.
Yeah, in procedure side also that I think at this point, I don't think AI has a role in the cath lab while we are doing the procedure. But for sure, in terms of planning the procedure, it can help a lot. Like
it can give you a roadmap. So in the cath lab, I know you and I do TAVRs, but it can give you exact roadmap of where that curve in the aorta is going to happen, have you start turning or trying to cross a valve and trying to get it through that small stiff wire across a small orifice area.
Yeah.
It could definitely help guide you in that front as well.
Yeah.
But maybe one day, there can be, the catheters can be steerable with the AI in the background, and you just kind of launch it and let it go, and it kind of finds its way to the right place.
Yeah, and I think AI probably could, help us giving really good informed consent for the patient also. It may be able to individualize that what are the chances of complication for the particular patient, because when we quote the complication to a patient, those are general complication rate. They are not specific for that patient.
Right.
He may be or she may be high risk for something or low risk of something of a certain procedure, but we sort of quote just the standard percentage, but that patient may be a high risk for something
Right.
and low risk for something. And I think giving the informed consent would be better also for the patient.
And I just want to comment on statistics of complications in general. What we rely on is mass data, population data, and say if you had an aortic valve replacement, your risk of having a major complication would be 2% based off thousands and thousands of data. But it doesn't take into consideration that if you were having it done by surgeon X at this hospital at this time of day, what your complications might be, and it can be vastly different. And this is where the mass data, the machine learning can help fine tune and better predict adverse outcomes or even good outcomes along the same lines.
Yeah, you're absolutely right. Now, I see that you're wearing Whoop. And so tell us about, wearable tech and how it's going to impact how we, take care of ourselves and guide us for our health.
I think it's also going to transform how much insight we know about our bodies, but also how much potential there is for us to better take care of ourselves. So, for example, I don't get any proceeds from Whoop. I do not get any commission. But I tell you what the Whoop does do is it measures your heart rate 24/7. The Apple Watch does that too. It has AI algorithms to know how much you slept, at what depth you slept. But the forward-thinking part of it is like, okay, well, you are in a sleep debt. You have to go to bed at X time. So it'll tell me, to get your full sleep's rest, you should go to bed at 10 o'clock, and you need to wake up you can wake up at this time. So that's where the technology comes in, the personal technology, using the data banks of information out there to then predict what the best amount of sleep you might get. Mm-hmm. What the nice thing about this technology too is that, and how it's related to medicine, is that there's definitely some data suggests that in patients or in people who have complications or diseases, there are probably changes in your biometrics that you're not aware, you're not cognitively aware just yet. But it happens. Maybe your heart rate gets a little bit faster. Maybe your QR interval gets tighter. A lot of things can potentially happen. We don't feel it or see it, but these technologies can pick up on that. So there's a lot of research in device development using biometrics, whether it be the Whoop, the Fitbit, other companies out there to better predict potential complications after surgery, better predict even potential diseases. Maybe if you have cancer or something, that you can better predict that. So I think there's a huge opportunity in that, and I think the field's completely open right now. Yeah,
I think what you're outlining is that remote patient monitoring after having a procedure or surgery, and it would be so powerful that if we can, because one of the things that we get ranked on is also readmission rate, right? And if we are able to prevent the readmission and pick something up that if patients are based on the remote patient monitoring and see them in the office before it gets too late that they have to get admitted and keeping them out of the hospital. And I think that's where the future is. Many major health institutions are basically investing money to make sure that they're able to take care of some of the illnesses at home. So some institutions have, spent money to decrease the in-hospital admission by 10% in the next 5 to 10 years.
Yeah, I think the other side too is also gives the patients a peace of mind too, knowing that they are being constantly monitored by not only the physician, but they're being, things are being picked up. It might be able to pick up, something's happening. You should probably go see a doctor sooner than later. Yeah. And I think that might give some folks a little bit peace of mind.
Yeah.
You talked a little about research. Can you tell me more about the potential for using, whether it be Fitbit or any other kind of technology out there, to really kind of advance medicine and do research, or maybe any potential research projects that you might have using AI technology?
Yeah, so with AI technology, the research for sure that you can do, like with the Apple Watch, there are algorithms out there that even with the 1 lead EKG that Apple Watch does, you can predict the occult atrial fibrillation. So that is something that you can do, that how many patients or people are out there who don't have the diagnosis of atrial fibrillation, and those who are wearing the Apple Watch, and what's the incidence of occult atrial fibrillation. Because that's a big deal, as we know that the atrial fibrillation increases your risk of stroke. So maybe by doing this, we can prevent some of this stroke also in the future. And, I think you and I both are working on the AI research with some of the FIU, project that we are working on, where, having the auscultation as, an evaluation for the valvular heart disease, and pick the valvular heart disease earlier in the disease process before it becomes too late. And as you pointed out earlier, just give you an example of aortic stenosis, there's 50% mortality at 2 years once they have severe aortic stenosis and symptom started. So that's, having 6.25% mortality every 3 months, that's a huge number. I mean, for us, when we do a procedure, having a mortality more than 1% is high, and more than 8% we consider a high risk for surgery. So, those are some of the research that we are doing. And, and AI would also have a help the student and us in writing the paper also, right? Because previously how we used to write the paper and reference the article was so cumbersome, where, initially the process was manual, where we would reference the article for the statement that we are using from the article manually, and then EndNote came, it made it slightly easier. But now, the AI can help us reference those article, and it would take few minutes, and you don't have to spend days, making sure that your article references are in good place.
Well, as you know, one of our most prestigious journals and most highly impact journals, New England Journal of Medicine, and AI has become such an important topic that now New England Journal of Medicine has a dedicated issue on AI, New England Journal of Medicine AI, and the very first journal was actually released in January 2024. But what's interesting, if you dive deep into the author rules for writing articles, the New England Journal of Medicine actually condones the use of generative AI for writing articles, which is a little bit maybe controversial. I don't know. I'm curious your thoughts on it, but they recognize that the technology is here. It's going to stay. They're going to embrace and adopt it with a set of rules and guidelines if you're going to use it. What are your thoughts on using AI to write journal articles? I
think that's fine. And I maybe, you can ask if the ChatGPT 4 is being used for that, you can ask question multiple times, and then based on your style, it would be able to, write the article. And as long as it's being done with some, supervision, and obviously there's a good input to the article, I think that's okay. We're going to have more research coming out into the medical field as long as the data is, robust. Because that's all we care about, right? Right.
And I think the way the New England Journal of Medicine defends it is that at the end of the day, whatever is written, you have to own the data and you're responsible for the data. And you disclose that I am responsible for this data. and how it was generated, is up to you. But they do say that you can't have ChatGPT as a co-author. Well, Nish, it was incredible talking to you about AI. I think you and I agree that we're only at the tip of the iceberg, and look forward to further discussions about how AI is going to change not only medicine, but humanity. But I think you and I probably agree that it needs to be regulated and closely watched. AI now is at a vanguard of not only taking cardiovascular medicine surgery, but the whole field of medicine to levels only recently dreamt of. It's paramount to practicing physicians to stay current on all new technologies, incorporate them into their daily practice. This promise for the field of medicine gives us tremendous hope for saving and enhancing countless lives, not only for our community, but on a global scale. Any final thoughts? What's your prediction of the most influential technology using AI that might happen a year from now?
Year from now, I think as we talk about, having EMR cross-reference, that's going to be more utilized because that's already here. So the more institutions would start using it, and then eventually, I would say that that EKG, EKG as
something
a tool of
basic
diagnosis.
EKG, yeah. Well, the field of innovation continues, and with it, hopes for millions in the future. As these proven advancements come into view, we will continue to bring the best treatments for our patients and colleagues.
To find out more about the topics covered on the Doc to Doc podcast, please visit physicianresources.baptisthealth.net.